Welcome back. June is National Older Americans Month, and this morning we are highlighting ways to help your elderly loved ones remain independent at home as they age. So this morning we are joined by Mario D'Aquila, Vice President of Assisted Living Technologies and member of the Connecticut Care Planning Council, Attorney Hank Weatherby. Gentlemen, thank you so much for being here this morning. I appreciate it. This can be a really difficult topic. How do you first have that conversation with your loved one that they may need that extra care in the home?
Well, unfortunately, all too often it comes up after there's been a serious health issue. But, you know, the best way is simply to sit down and talk about where your parent wants to live and what kind of plans they've made so that their current environment allows them to age in place. In fact, that's one of the real strengths of Mario's company, in that they furnish a lot of tools that allow people to stay at home where they might not otherwise be able to do so safely.
And how do you know how much do they need? You know, do they need 24/7 care, or do they just need someone to come by and help with the laundry maybe a couple times a week, maybe cook a meal or two? How do you know where your loved one, you know, is?
Well, you really want to have a home assessment done, so having one of our elder care professionals go out, view the home, speak with the family, kind of analyze the needs of the elder. That way we get to thoroughly discuss whether or not they need 24-hour care or maybe just hourly personal care.
And how much does something like this go for? I mean, it can be expensive to try and take care of a loved one.
Well, definitely it can be, but there are some other funding sources out there that can cover the cost for elder care that the state of Connecticut covers through the Department of Social Services, which is always a good idea to look into.
Yeah, definitely. How big of an issue is this? I mean, how many people are taking care of elderly loved ones?
Economically, family members are furnishing equivalents of about $400 billion a year in care, and is costing employers in terms of lost time at work, distracted work, on the phone with the doctors, and taking time off to take mom or dad to the doctor. All of that adds up to, for businesses, a loss of another, you know, $300 or $400 billion a year.
Wow.
It's a huge impact. I mean, you end up with caregiving isn't a tremendously taxing thing to do. If you think about it, you've got young children. In many cases, they're teenage children. You've got your life, social life, work life, and you have your parents' life. And literally, you've got, you know, 2 or 3 full-time jobs. I have clients who talk about being a sandwich, and I've got a couple who say, well, I'm really a roll-up because I'm taking care of a sibling who's got issues and whatever. It is one of the most demanding things that people do within their family, is try and become a caregiver to somebody else, especially an adult, because you do have to try and be respectful of their wishes and what they think makes sense. You have to get your head around medical issues as well as financial issues. In fact, that's why in our practice, while we're a law firm, one of my key people is a social worker that helps try and make sure that we integrate what the law allows us to do for people with what they really need in their personal life.
Wow, wow. Some great advice, some great information, especially if folks are dealing with this, that's for sure. Thank you so much, Henry. I appreciate it. Mario, you too. For more information, just head to our website, head to WTNH.com, just click on the On Air tab and pull it down to the Good Morning Connecticut Weekend section.